A thorough and systematic examination of each new orthodontic patient is essential for accurate diagnosis to be made. Accurate diagnosis is a guarantee of making an appropriate treatment plan. It's very important to keep sequence of examination. You should collect patient's database, personal details, chief complaint, medical history, dental history, to provide extraoral and intraoral examination. Extraoral examination begins with establishment of contact with the patient.
What is your name?
Меня зовут Саша.
How old are you? Сколько тебе лет?
Мне 18 лет.
18. Okay. Where do you study in? Где ты учишься?
Я учусь в медицинском университете.
He is studying in medical university.
Notice lip competence, word spelling, and breathing while patient is speaking. Chief complaints consist of aesthetic drawbacks, chewing, biting, speech disturbances, bleeding of the gums, clicking and pain in temporomandibular joints.
Why do you come to meet me? Почему ты обратился к нам?
У меня жалоба на относительно маленькую верхнюю челюсть, немного кривые зубы, и хочу, чтобы фронтальные передние зубы стали немножко впереди, чем задние.
Okay. He complains of small maxilla, crooked teeth, and he would like to move frontal teeth forward concerning the lower teeth. Okay.
Dental history. The most important is to find out information about early or late eruption of deciduous and permanent teeth and premature loss of teeth. Past medical history. It's important to screen past medical history using a medical questionnaire that you can then discuss with the parents. Also, you should ask about pre- and postnatal history, such as pregnancy conditions, type of feeding, infections, rickets, traumas, etc. Extraoral examination. Orthodontic assessment of a patient begins with an extraoral examination. This involves detailed assessment of skeletal pattern, soft tissues, functions, and temporomandibular joints. Skeletal pattern is the relationship of the mandible to the maxilla and the relationship of each to cranial base in all three planes of space.
Now we assess a skeletal pattern in anterior-posterior plane, in sagittal plane. We assess patient's profile by position of 3 points: nasion, subnasion, and pogonium. These points should lie on the same line, in the same plane. In this case, we have retroposition of subnasion. This is in accordance with the retroposition of maxilla. This type of profile is called concave profile and may be associated with 3 skeletal pattern of patient.
Class 1. Mandible is 2 or 3 mm posterior to maxilla, straight profile. Class 2. Mandible retruded and or maxilla prominent, convex profile. And class 3. Maxilla retruded and mandible prominent, concave profile.
Skeletal pattern in vertical plane should be assessed in frontal view of patient. We should assess the height of lower and middle facial height. It's necessary to measure the height of the middle and the lower facial height from the points on the from ophrion to subnasion. It's a middle facial height, and from subnasion to gnation, it's a lower facial height. In normal patient, these heights should be equal.
Increased low facial height is associated with vertical growth pattern. Decreased lower facial height is associated with horizontal growth pattern.
In transverse plane, we assess symmetry or asymmetry of the face. You should assess the points of eyebrows, eyes, area of nose, angle of the mouth, and position of the chin concerning middle line of the face. Our patient has slightly asymmetrical face.
Soft tissues. It is particularly important to assess soft tissues carefully to find out are they the cause of malocclusion or they have adapted to it. Soft tissues examination includes examination of lips, chin, mandibular fold, nasolabial folds, and examination of the nose.
Examination of lips should include investigation of forms, tonicity, fullness, and competence of lips. Our patient has insufficient anatomical length of upper lip due to surgical scar, sufficient fullness of the lower lip. These lips are competent. Examination of chin includes assessment of position and prominence of chin. Prominence of chin is associated with 3-class malocclusion. Assessment of mental activity muscles. Normally, we should see absence of mental activity, some contractions or tonicity. If we have this, it's thimble symptom, a symptom of infantile swallowing or habitual oral breathing. Now we assess expression of nasolabial and mentolabial folds. Normally, they should be shallow. In this patient, nasolabial folds are expressed and mentolabial folds is shallow. Assessment of the nose. Our patient has got normal size of nose, normal width of bridge of the nose, oval shape of nostrils, area of nose don't involve in the breathing.
Functional examination. It is very important because careful and thorough elimination of functional disturbances guarantees stability of treatment results and prevents after-treatment relapses. Examination of functions involves breath pattern, swallowing pattern, speech articulation, and assessment of TMG.
Assessment of respiration or type of breathing. There are 3 types of breathing: nasal, oronasal, and oral. Our patient have competent lips and nasal type of breathing. Assessment of swallowing. We ask our patient to swallow. Проглоти, пожалуйста, слюну. Normally, during mature swallowing, we see absence of some participants of muscles of oral cavity. But now we see tension of muscles of lips. It's a sign of infantile swallowing. To check the presence of infantile swallowing, we try to move the lips of the patient and ask patient to swallow again. Проглоти, пожалуйста, опять. Еще раз. Now you see the real position of tip of the tongue and thrusting of the tongue between the teeth. And I feel the tonicity of the lips during swallowing. It's a sign of infantile swallowing. Assessment of speech. For assess of function of speech, you ask patient to speak or to tell some key words or some key phrases. For example, скажи, пожалуйста, 333.
333.
Thanks a lot. You see patient's speech with some signs of lisping and nasal tone. TMG examination. For TMG examination, we should put fingers on the area or the region of the condylar head. We instruct patient to open mouth widely, slowly, in a vertical and lateral plane. Пожалуйста, открывай рот. Закрывай. Еще. Закрывай. Открой, пожалуйста, рот. Перемести челюсть влево, вправо. Thanks. Any clicks, pain, or hypermobility are indication for more deep investigation of muscles and others.